I have focused since day one in Congress to make sure that everybody in this country, no matter who you are, no matter where you live, have access to quality, affordable health care. The Affordable Care Act allows folks to do that, to be able to access quality insurance and make sure that it is actually affordable for them based on the income. We want to continue to expand the Affordable Care Act to folks who may not be covered by any other type of insurance plan, that they know they can get quality insurance that's paid for. There are enrollment periods that are set where people have to then sign up, normally at the end of the year. But in the midst of a pandemic, this is a crisis for everyone, and folks can lose a job for no fault of their own, for whatever reason may find themselves without health care. And it's a frightening prospect when you know that your family could be impacted by the pandemic and be hospitalized with very, very large bills. And so this is critical for families to have the kind of security that they need. I certainly pressed the Trump administration last year aggressively to open up enrollment, not just during the traditional enrollment period, because we were in the midst of the pandemic. Unfortunately, the former president refused. But I'm happy to say the Biden administration understands how important it is to have quality, affordable healthcare, and has now opened up enrollment. It actually started yesterday and will continue through May 15th. So folks have the next few months to sign up, and certainly would encourage anyone who currently does not have healthcare to check out the site. You're going to learn more about it through this call, but folks can get more information at www.healthcare.gov. And there's also an 800 number, 1-800-318-2596. And folks can get more information. But we wanted to put this out to all of you. We'll hope that you will pick up this story and let folks know, whether they're listeners, readers, or viewers of your station, that they understand that their worries about having access to affordable health care have gone down because the Affordable Care Act is once again open, and that they can start signing up. So with that, I want to turn it over to Anita Fox, who's Director of the Department of Insurance and Financial Services for Michigan, to tell us more about how important this opening is. Thank you, Anita, for being with us.
Well, thank you, Senator Peters, for having me here today on this important topic. And thank you for your leadership all across all your terms, and now on this important priority for Michiganders and their families. It's always important for Michigan residents to have access to affordable, high-quality health coverage, and as you mentioned, now it's more important than ever. And that's why, under Governor Whitmer's leadership and with the support of Senator Peters and Senator Stabenow, Michigan was the first state to call upon the federal government to open a special enrollment period in the early weeks of the pandemic, and we repeated those calls to the administration throughout 2020. We did this because we know that comprehensive health coverage leads to healthier families and a healthier, more productive Michigan, providing access to care for illness and injury, but also for preventative care, including childhood immunizations and cancer screenings. And this coverage, as Senator Peters mentioned, is even more critical in the middle of a pandemic to cover things like testing and treatment, and as we work to protect people and slow the spread of this deadly virus. Before the pandemic hit, more than 500,000 people in Michigan did not have health coverage. And we know that tens of thousands of more Michiganders lost their health coverage during the pandemic. The state of Michigan recognized that we needed to use every single tool at our disposal to address this problem. We called on our federal partners to take action and move forward with our own efforts to protect Michiganders. We used CARES Act dollars to partner with the Department of Health and Human Services in Michigan to conduct a $1 million outreach during last year's open enrollment to get people covered under the Affordable Care Act. Through that effort, we saw marketplace enrollment increases that had declined for year after year back to 2017 increase for the first time. And that's a huge gain for Michigan. But we know there's still work to be done. And we thank President Biden for taking swift action to give Michigan residents this opportunity to get covered when we could not get any of that relief under the prior administration. If you need health insurance or even want to see if you can lower your costs, we're here today to urge you to take action today, to not wait, and to go and look and find a plan at healthcare.gov. Common misconceptions are that getting covered is expensive or too complicated. So many people go without coverage and leave themselves and their families at risk for poor health outcomes and steep medical bills. But in reality, there's assistance to help you get signed up, and there are low or no cost options available. And the website or call center will guide you through your options. In fact, nearly 90% of Michiganders and even nationwide receive some type of subsidy or tax incentive that lowered their costs for health insurance. And nearly 75% of people nationally who enrolled last year are paying as little as $50 per month for comprehensive health coverage. And in almost every case, people who lost their employer-sponsored health coverage and got continuation through COBRA were able to find less expensive coverage through the marketplace exchange. Healthcare.gov makes it easy to determine what plans are available without logging in or even creating an account. You can shop through the site and take a look at your options. And what's more, no cost local enrollment assistance is available with just 2 clicks. You go to healthcare.gov, click on the button that says Get Coverage. There's another button that says Find Local Help, and that will tell you how to set up a Zoom or telephone conference with a local agent or navigator who can give you personal assistance and walk you through the process. And fortunately, there is no wrong door to get started. We know that there are other programs that you might be eligible for, whether it's Medicaid or programs for your children. But if you go through healthcare.gov, the marketplace tools will guide you to other programs that you're eligible for. So on behalf of Governor Whitmer and the Michigan Department of Insurance and Financial Services, we join Senator Peters and President Biden in urging you to protect yourselves and your families by signing up for coverage during this special enrollment period. Visit healthcare.gov, or as Senator Peters mentioned, you can call in if you prefer to 800-318-2596, and the site or the person on the phone will lead you through your options. The only mistake you can make is to miss this opportunity that has been reopened. So don't wait. There's a May 15th deadline, but if you put it off, you're likely to forget. After this is over, get on healthcare.gov and get coverage for your family or explore your options. So with that, I will turn it back over to Senator Peters and his staff. And thank you.
Well, thank you, Director Fox. Thank you for your leadership, and certainly Governor Whitmer as well for her leadership. And you're absolutely right, Director Fox. Don't wait. Do it now. It's going to be open for a while, but those are for other folks who may be losing insurance. But if you do not have quality, affordable health insurance right now, certainly check out the site. And to help us understand what will happen when you go to that site, we have Melanie Grund here, who she can talk about her experiences. And I know you've navigated a lot of people through this process. And what should folks expect, and how do they sign up? Thank you, Melanie, for being on.
Yeah, thank you for having me, Senator. Way back in the beginning of the ACA, I actually was a certified navigator myself. And I'm sure everyone remembers it didn't go as smoothly as we had hoped in the very beginning. So we got to know a lot of the intricacies of it. What I'd like to point out is I've actually used the ACA myself for the last 5 years as a self-employed person, and those problems are gone. The site has become much more smooth. The navigator that was spoken about, I highly recommend if you're not comfortable on the computer. The phone call is one thing, but a navigator who you really feel is on your side and can answer questions about your kid in college, or perhaps a dependent that you have, any of those sort of slightly different situations, that's all very answerable, and you don't need to be intimidated by it. I would like to put in a pitch, though, that the site has become very intuitive, pretty simple, especially if you've used it at any time in the past. Even if you only used it 1 year, that information is still in there, and it just sort of updates for you. So it walks you through, much like if you did your IRS taxes online, that information is still in there. So it's become very simple. I think more friendly than it was in the beginning. And I think the fact that so many of our neighbors have lost coverage in the last year or so, maybe still facing the rest of this year without, as they look for jobs. And if unfortunately they've had ongoing health issues from COVID, I was really excited to hear that we were reopening for a special enrollment period. As the senator said, don't wait, do it now, because actually as you input your information, you can select for your plan and it actually will start the following month. So if you wait till the end, if you wait till May 15th, then you're waiting till June to get that healthcare coverage. So you want to do it sooner rather than later. Again, the plans, you know, the ability to give people some healthcare for $50 to $70 a month that is comprehensive, that doesn't have ridiculous deductibles, etc. I find it very simple to walk through. So as a user and as a navigator, it has only improved since, what was it, 2011, I guess.
Great. Thank you, Melanie. I appreciate that. So the insurance will start if you get on now. It's going to start the beginning of March 1st if you sign up going forward. So that's just a short time away and folks can do it. Perhaps maybe just briefly, if you would please, if you sign up, what screens do you see and how many steps does it take normally for someone to?
You know, you put in your basic family information, personal information, family information, amount of screens. That really varies on answers to your questions, but it does direct you entirely through it, very much based on your answers. So you don't have to worry so much about, did I go to that screen? Did I remember to do something? It'll ask you, again, very much like e-filing for your taxes. It will say, do you want to know more about this question? If you feel confident in answering it, you don't need to go to that other step. But if you do have questions, it'll move you to that. You know, it probably takes maybe half an hour. And that's if you read a lot of the steps along the way. Again, if you have your information in there from a past year where you may have used the ACA, it maybe takes less time than that even, but I would say half an hour is probably a good time frame. If you're using a navigator, if you're using someone to assist you, it can take longer because they're going to walk you through answering some questions. But if you're sitting down by yourself, 30 minutes is probably good.
So for in less than a half hour, someone can get online and get quality, affordable healthcare and make sure their family is protected during this COVID crisis.